Hello everyone, welcome to sqadia.com, and in this fourth section of our lecture topic menopause and post-reproductive health, we will talk about the effect of menopause on the health of the female. And in this section, we will talk about the effects on the vasomotor system and effects on the psychological or the nervous system effects of the menopause. So postmenopausal reproductive health, usually the continuation of care is important. So we've already talked about how we can manage patients with menopause. There is hormone therapy and non-hormone therapy. So it's important that the patient should be managed accordingly and continuation of care should be done. Then management of obesity in postmenopausal women is also important. Try to reduce the weight, and eating habits should be healthy, and exercise should be done regularly. And this also in turn decrease the severity of symptoms in the postmenopausal women. And then also try to improve the health improvement plans. Again, the lifestyle should be changed, eating habits should be changed, exercise should be done regularly. That improve the symptoms of the menopause in the postmenopausal age. This graph here shows the total number of total population here. And then we have a population over 50 years, over 60 years, 70, and over 80 years. Here, this is the period between 212 to 237. So they are showing different population and how much they will be affected by the menopause and the symptoms of the menopause. Effects of the menopause by time of onset is important. So depending on the onset of menopause, it divided into immediate effects of the menopause, intermediate effects, and the long-term effects of the menopause. Immediate effects of the menopause are usually between the time when there is onset and 5 years of the time period between the onset and 5 years of the menopause. And usually this time period there are usually hot flushes, night sweats, there are anxiety, tearfulness, so crying spells are very common, loss of concentration, poor memory, joint aches and pains, dry itchy skin, hair changes, and sexual desire is decreased. So these are the changes that occur within first 5 years after the menopause. Then within 3 to 10 years after menopause, usually there is vaginal dryness, soreness, dyspareunia, which is painful intercourse, urgency of urine, recurrent UTIs or urinary tract infections, and urogenital prolapse. Prolapse is the bulging of the structures, like bulging of the vagina, cervix, uterus outside. That's the prolapse. So these are very common in the middle time between 3 to 10 years. And then after 10 years, usually there is osteoporosis, cardiovascular changes, and memory loss. So slow development of osteoporosis and cardiovascular changes after the menopause. Usually they start after 10 years of the menopause. Some vasomotor symptoms of the menopause are hot flushes, night sweat, deep rapid eye movement, loss of most of these are due to loss of estrogen effect on serotonergic receptors, and also there is vasodilatory response. These changes due to vasodilation of the blood vessels. These effects occur in about 80% of the females have hot flashes, night sweat, and deep rapid eye movement. Some psychological symptoms: there is anger, there is anxiety, depression, irritability, dizziness, and there is fatigue, and mood swings are all very common after the menopause. So this was about the vasomotor and psychological symptoms of the menopause and the different effects of the menopause depending on the time period. So thank you for watching sqadia.com.